Hello, you are listening to the RxConnect Podcast. This podcast is brought to you by the pharmacy operations at the American Oncology Network. We are committed to delivering operational, clinical, and financial efficiencies based on the most sustainable model, reshaping the future of community oncology practice. I am your host, Melody Chang, VP of Pharmacy Operations at the American Oncology Network. For our new audience members, we have dedicated considerable time in our previous podcast series to discussing drug shortages. Last month, we also explored an important class of therapeutic drugs, specifically bispecifics and cellular therapies. Today, in episode 6, we will dive into another significant yet often overlooked class of drugs known as 505b2 drugs. To listen to the podcast and to read the transcript, please visit our website at www.aoncology.com. I'm delighted to introduce you two guest speakers. My first guest is Dr. Nicole McMullen. Dr. McMullen graduated from Ohio Northern University and completed her oncology pharmacy residency at the James Cancer Hospital at the Ohio State University Wexner Medical Center. She is a board-certified oncology pharmacist and is a regional clinical pharmacist with American Oncology Network. Welcome, Dr. McMullen. My second guest is Darell Connor. Darell is the project manager at American Oncology Network. He has 16 years of experience as a pharmacy technician. He joined the pharmacy operations team at the AON since the AON inception. And we're so proud of Darell because he now is a third-year pharmacy intern at Creighton University and serves as the ANCODA chapter president, executive team member of the Clinical Reasoning Club, and distance liaison for Pi Lambda Sigma. As a project manager, Darell has contributed significantly to numerous pharmacy operations initiatives at AON, including this podcast. Thank you and welcome, Darell. Many of our listeners are quite familiar with brand, generic, or even biosimilar products, but there seems to be less awareness about the 505b2 product. I'm going to ask Dr. McMullen, could you start by explaining to our audience what exactly a 505b2 drug is, and perhaps highlight how it differs from the other drugs?
Thank you, Melody. Yes, I can definitely shed some light on this topic. So like Melody said, many of you may be familiar with a brand or generic drug, but this 505b2 product may be something new that you haven't encountered before. So a 505b2 product is a drug that's approved through a specific pathway through the FDA. And the FDA has these pathways which prescription drugs gain approval. So for a brand name drug that we're familiar with, their company submits a new drug application or an NDA. And for generic drugs, the company will actually, give out an abbreviated new drug application or an ANDA. So the 505b2 pathway is just a hybrid of the two, and it's an accelerated drug approval pathway that was created under the Hatch-Waxman Act of 1984. So let's just dive a little bit deeper and see what the differences are between the NDA, the ANDA, and the 505b2 pathway. So you're probably wondering why we're calling it a 505b2, right? So a brand name drug falls under the pathway for an NDA, and that's the new drug application, and that's under the 505b1 section. And again, an NDA is for brand name drugs, and they require extensive clinical evidence, which includes pharmacology, pharmacokinetics, clinical efficacy, side effects. All that information is needed for their approval. Now we contrast that with an ANDA, which is used for generic drugs. And the reason we do an ANDA is that these drugs actually have to show bioequivalence to the brand name product before they are approved. So now let's take a step back and talk about the 505b2. Now, how is a 505b2 different? So like I mentioned, it's a hybrid of the NDA and the ANDA. And this pathway was created in order to prevent duplication of previously reported safety and efficacy data. And it's an accelerated pathway that allows drug manufacturers to submit their product for FDA review with data that's not their own clinical research. And the manufacturer just can submit previously completed research for evidence for drug approval to the FDA. So I hope that sheds some light on what are some of the differences between the three pathways.
Excellent, excellent. That was a very comprehensive explanation. Thank you, Nicole. And it helps clarify a lot of nuances involved. So could you explain a little bit more? What are the benefits of developing a 505b2 drugs?
That's a commonly asked question. So you're thinking, we have brand and generic drugs, so why would we need this class of 505b2? So when you're looking at brands and generics, in order for a generic drug to gain approval, it has to be the same dosage form, the same dose as the reference or brand name drug. And that's where the 505b2 pathway comes into play. So while a 505b2 drug and a reference drug may have the same active ingredients, a drug company can actually expand the utilization of that drug to reach more patients. So an example of that would be that maybe the drug company wants to create a new dosage form that makes it easier for patients to take, or maybe they've developed a new route of administration or a new delivery system of the drug that aids patients. And one of the other examples is that if you have a previous drug that is prescription only, you can use the 505b2 pathway to gain OTC approval. And this process actually saves the drug manufacturer a considerable amount of time and resources.
Wonderful. Thank you for elaborating on that. And could you also give us some examples of those 505b2 drugs on the market?
Yes, so you may have encountered these in practice, and maybe you didn't even know that you were dispensing some of these 505b2 drugs. And so some of the examples in the oncology practice, and I just want to make a side note that we are seeing more of these in our oncology practice setting. And so there's several of them that have their own trade names. And so Pemfexy is a 505b2 drug that we're seeing in oncology, and that the reference product for that is Alimta or pemetrexed. We're also seeing a drug called Vivamusta, which is a 505b2 for bendamustine. And then some of the other drugs will use their generic names, and you may not be able to differentiate them only on the drug manufacturer. For example, there is a 505b2 product of fulvestrant that's manufactured by Fresenius Kabi. And so that's one of the challenges, is being able to identify which drugs are 505b2 versus generics and brands.
Excellent. Thank you. My next question is going to be for Darell. Darell, I know you have extended experience as a pharmacy technician. Now you're a pharmacy intern, pharmacy student, and in the school. So I want to ask you, from your experience, what does the clinical staff need to consider when ordering and dispensing the 505b2 drugs?
Absolutely, Melody, and thank you. And going off of what Dr. McMullen had mentioned, being able to differentiate 505b2 drugs versus drugs that are non-gone through that pathway, the main thing that clinical staff need to remember is that the 505b2 product actually will have a unique J code that's different from the actual reference product. Now, which could result in a billing error, if you imagine, if they were dispensed for the reference product. Now, clinically, there should not be any harm to the patient for 505b2 products if it's dispensed to the patient. However, you have to keep in mind, because of that J code, clinics may actually not be reimbursed for that drug on the difference in just that NDC and J code. So what we would recommend is pharmacy administrators to collaborate with their medical dispensing vendor to kind of create unique identifiers, however that may be, whether that be in the form of badges, alerts, something to be embedded into their dispensing software to help clinical staff be better to differentiate and distinguish between those non-505b2 products and 50b2 products.
Excellent. Thank you for those insightful answers. So talking about what the clinical staff need to be considered, I believe you also observe some challenges dealing with the 505b2 drugs. Could you also elaborate more on that from an inventory management standpoint?
Absolutely. So using that example that Dr. McMullen mentioned regarding fulvestrant. So if you just see fulvestrant, well, is that the fulvestrant from Fresenius Kabi? Or is that a fulvestrant from another generic manufacturer? So being able to create these internal enhancements, as I mentioned earlier about those unique identifiers, is very pertinent to identifying those 505b2 products. This is going to be helpful whether the practice or the team is analyzing reports internally, updating regimens within the EMR that they're using, and of course, as mentioned earlier, evaluating those return on investment and utilizing these products in comparison to the other generics already available in the market. So those are some very key points that need to be considered along with those challenges when it comes to dispensing and handling these types of products.
Thank you. And I believe that there got to be more products in the future on the pipeline development we're going to see more products coming to the market with the 505b2 labels on that. Well, great. Yeah. Before we conclude today's podcast, I want to extend our thank you to Darell and Nicole for sharing your valuable insight and expertise with us. And we're truly grateful for your time and knowledge. Do you have any thoughts you want to share with our audience before we conclude today's podcast?
I just want to say thank you, Melody, for having me on here. And I just think this is a great highlight to clinics, the importance of identifying 505b2 products in your practice. And just knowing that there are more in the pipeline that are coming out and possibly implementing practices within the pharmacy so that all of your providers are aware of if these drugs are 505b2 and that all of your staff is also aware and utilizing some of those practices that Darell recommended and will really help to optimize the use of these drugs.
Thank you. I'd like to thank our audience for listening. This podcast is brought to you by Pharmacy Operations at the American Oncology Network. You can listen to all the podcast recordings on our website at www.aoncology.com. We hope you enjoyed this episode and look forward to seeing you at the next one. Thank you.